Welcome to the Zoetis instructional video for the mixing and application of Rhinogard vaccine. Zoetis has developed the Rhinogard intranasal spray applicator to allow you to safely administer Rhinogard in a fast and simple way. The Rhinogard intranasal applicator has a specially designed spray nozzle that effectively delivers an aerosolised vaccine dose through single-handed vaccination. The Rhinogard intranasal applicator delivers the fixed 2 ml dose, the correct dose for Rhinogard. Rhinogard is the only live single-dose intranasal vaccine for infectious bovine rhinotracheitis, IBR, in cattle. Australian surveillance shows that IBR is one of the most common viral components of the BRD complex. Cattle are at risk on farm and in the feedlot, with 80 to 90% of Australian cattle herds demonstrating evidence of prior exposure to IBR. When Rhinogard is delivered intranasally, it will stimulate a local immune response in the upper respiratory tract. Non-specific immune mediators and secreted antibodies that are produced provide protection against respiratory disease at the site where it enters the animal's body. The presence of these non-specific immune mediators at around 4 days post-vaccination has been found to be associated with a decline in viral replication. Field studies that were conducted for the registration of Rhinogard showed that when the vaccine was given prior to field challenge, it improved the average daily gain and the feed conversion efficiency in cattle compared to cattle that did not receive the vaccine. Rhinogard IBR is a highly effective, potent vaccine that protects your cattle from IBR in a single dose. Prior to vaccinating, make sure you read the label. Every vaccine has a unique registered label that provides important information and instructions that need to be followed to ensure the vaccine is delivered safely and effectively. The label explains the diseases the vaccine protects against, information regarding the product efficacy, steps for the safety of the animal, the environment and the operator, instructions regarding how to use and store the vaccine, and how to dispose of used vaccine containers. Check the expiry date on all vaccines to ensure that the oldest vaccine in the fridge is used first. There is no withhold period on any Zoetis vaccine. Each Rhinogard IBR carton has a unique identifier which enables this vaccine to be used in pre-vaccination programs for feeder cattle. Talk to your local buyer for how you can participate with their feeder cattle program. For Rhinogard, it's important to check for cattle which are destined for live export. Advice should be sought on the use of IBR vaccines from the exporter or the consultant veterinarian before administering the vaccine to ensure the cattle will meet the pre-export testing protocols for the destination market. When using the applicator, it is important that you take your time, handle the animals calmly, and ensure that human safety is a priority. Correct use of the applicator will increase your safety, it will reduce the risk of adverse events, and improve the overall vaccination experience. If you or someone you are working with observes a suspected adverse event, including human exposure or an animal reaction with any Zoetis product, please contact our product support team on 1800 814 883. It is important to set up the applicator correctly and undertake regular maintenance for the best results and to ensure user safety. Ensure you have the correct applicator, as Rhinogard must be delivered through a spray nozzle that correctly aerosolises the vaccine into the nasal cavity. Always check there is no product in the applicator or draw-off tube for both your safety and that of people around you until you're ready to vaccinate. Check the barrel is tight on the applicator and tighten clockwise if needed. Calibration of the applicator is important prior to use every time to ensure accurate dosing and to minimise wastage. To calibrate the Rhinogard intranasal spray applicator, connect the draw-off tube with the open end in clean water. Ensure the spray applicator is higher than the water source and prime by pumping the handle with the spray nozzle initially pointing downward to eliminate any air. Then carefully finish priming in an upward position until the barrel is completely filled with water. Test the dose accuracy by using a graduated measuring receptacle. First, set the dose rate at 2 ml, then slowly apply 20 full doses of water into the measuring receptacle. This should equal 40 ml. There may be a fault if this doesn't occur. If the volume does not measure 40 ml, check the setup and retry. If the spray applicator fails to calibrate a second time, return the applicator to your place of purchase. Before use, read the product label. Remove the 50-dose Rhinogard IBR vaccine pack out of the fridge and open all contents. Attach the needle to the syringe, push into the rubber stopper the 100ml saline pillow pack and draw up 20 ml of saline. Push the needle through the top of the Rhinogard glass vaccine vial and inject the saline into the vial. Remove the syringe, but leave the needle inserted to release the vacuum in the glass vaccine vial, and gently swirl, don't shake, to completely dissolve the vaccine with the needle in situ. Reattach the empty syringe and draw up the entire contents of the vaccine and remove the needle and syringe from the glass vaccine vial. Inject the vaccine back into the 100ml saline pillow pack and gently swirl, don't shake, to mix thoroughly. Double rinse the Rhinogard glass vaccine vial by drawing up 20 ml of reconstituted vaccine using the same saline pillow pack and inject into the glass vaccine vial with gently swirling to remove all of the residual vaccine. Reattach the empty syringe and draw up the entire contents of the vaccine and remove the needle and syringe from the glass vial. Inject the vaccine back into the 100ml saline pillow pack and gently swirl, don't shake, to mix thoroughly. Most Zoetis vaccines are registered to use with a draw-off tube. Attach the draw-off tube to the Rhinogard spray-tipped applicator. Insert the spigot, which is fixed to the middle of the orange screw cap, into the centre of the rubber stopper. Screw the cap on gently but tightly to ensure the firm fit is achieved. Ensure the spray applicator is higher than the Rhinogard vaccine and prime by pumping the handle with the spray nozzle initially pointing downwards to eliminate all of the air. Carefully finish priming in an upward position until the barrel is completely filled with vaccine. When the pack is getting low, you can allow air into the vaccine pillow pack to help empty the last bit of vaccine. When changing to a new pack of vaccine, ensure a new draw-off tube is used each time. Rhinogard is the only live single-dose intranasal vaccine for highly effective IBR control in cattle. Because Rhinogard is a live vaccine, it must be handled with care. It should not be exposed to sunlight or high temperatures during use. The use of an insulated pouch is recommended. All reconstituted vaccine should be used the same day, and if taking a break during vaccination, the vaccine should be placed in an esky with an ice brick to keep it cool during breaks. Rhinogard is available in a 50-dose and a 10-dose pack to reduce wastage. Rhinogard is a live vaccine and any contact with disinfectants or detergents may inactivate the vaccine, so never immerse the applicator in any form of disinfectant or detergent during use. Remember to use all reconstituted vaccine within 8 hours of mixing. Whether cattle are in a crush or in a confined space, it is important that they are restrained so that they don't move during vaccination. Always practice safe handling of animals when treating them to ensure that your safety and that of other people around you is a priority. When vaccination of weaners or larger cattle is implemented via the intranasal route, it is best to restrain the animal in a head bale with a chin bar. The head of the animal should be slightly elevated to ensure easy and safe access to the nostrils in order to administer Rhinogard spray. Place the white tip of the applicator inside the middle of one nostril only and spray one pump, 2 ml of vaccine, into that nostril. A single spray of Rhinogard provides effective vaccination against IBR. Only a single dose is needed prior to periods of disease risk for protection. There are no primer doses required. Clean-up and maintenance of these applicators should be undertaken at the end of the day's work. Always use gloves when cleaning your equipment. Ensure there is no product remaining in the applicator or the draw-off tube. Your safety and that of anyone around you is important. Fill a container of adequate size with clean water and mild detergent. While wearing your gloves, immerse the applicator into the water and prime it with the exit and entry orifices remaining under the water. Gently squeeze the handle 20 to 30 times. Remove and inspect. The applicator barrel can be accessed and more thoroughly cleaned by unscrewing the barrel. Wash this thoroughly to remove all material. Keep the applicator clean with a quick scrub. Rinse with clean, fresh water before reassembling the applicator to remove all traces of disinfectant and detergent. Rhinogard is a live vaccine, and any contact with disinfectants or detergents may inactivate the vaccine. Never expose Rhinogard vaccine or its applicator to disinfectants or detergents during use. To reassemble, apply oil to the O-ring of the applicator and then reattach the barrel tightly. Apply a drop of food-grade vegetable oil into the inlet spigot and then pump the handle several times. Applicators and empty product packs should be carefully placed in landfill garbage. For storage, always clean and lubricate the applicators with food-grade vegetable oil and keep in a clean, dry place where they'll be ready for use when you need them next time. Thank you very much for watching. I trust you found this informative, and if you have any questions, please visit Livestock Solutions on the Zoetis website for further information.